Well, good morning, everyone, and I want to start by thanking Dr. Mirtha Rosas for not only her leadership in her country, but her leadership at PAHO and being a great health champion and a good friend. Recognize Dr. John Andrus, the Deputy Director of PAHO, health ministers, stakeholders, colleagues, and friends here today. I'm delighted to have a chance to join this celebration on World Health Day, and I hope we get to the point, not only in this country but around the world, where we can consider every day World Health Day. I think that would be a good way to focus our energy. For more than a century, the Pan American Health Organization has been a driving force behind many of our region's greatest public health achievements, from reversing the spread of infectious diseases to improving nutrition, sanitation, and access to clean water. And thanks to this kind of progress, people are living longer and generally healthier lives than ever before. Now, just as recently as 1980, there were about 378 million people in the world aged 60 or older. 3 decades later, as we stand here today, that figure has doubled. And by 2050, it's projected to reach 2 billion. At that point, older people will be about 22% of the global population, outnumbering children under 14 for the first time in human history. Now, these gains haven't been limited to industrialized countries. The most rapid and dramatic demographic changes in the Americas are happening in low and middle income countries. So these trends represent a triumph of global public health, modern medicine, and economic development. And yet with them come new challenges. As people live longer, the shape of our families is changing. Adult children are caring for their aging parents while raising their own families. Many of us work well beyond traditional retirement age by need or by choice, stretching our caregiving capacities even further. And those shifts have begun to put new pressure on our country's healthcare systems and social safety programs, pushing policymakers to find new ways to make limited resources go even further. Now, we also know as we live longer, we're more likely to develop multiple chronic non-communicable diseases. In the past, more people died at younger ages from infectious diseases, accidents, and violence. But today, more and more of the world's population are living long enough to face cancer, heart disease, and Alzheimer's. Each year, chronic diseases kill about 36 million people worldwide, and that's more than 3 out of every 5 deaths, robbing families and communities of loved ones and costing our economies billions of dollars. Now, many of these diseases, like diabetes, stroke, and respiratory disease, are projected to affect even more people in the years and decades to come. For years, our region has helped shape the international conversation about non-communicable diseases. From the 2007 Declaration of Port of Spain to the resolution tabled by Trinidad and Tobago on behalf of the Caribbean community that ultimately led to last year's UN General Assembly high-level meeting. Now the rest of the world is joining our conversation. And that's critical, because we still have a long way to go if we want to turn the tide on chronic disease. These threats recognize no national or political borders. They touch countries in every corner of the globe and at every stage in development. So our challenge today is to prepare and respond. Now, the good news is that we know what it takes to build communities where older citizens are seen not as a burden, but as experienced and engaged partners. And the work we do to support healthy aging also presents us with an opportunity to reshape our communities to promote better health at every age. So here in the United States, we've embarked on an ambitious agenda to shift the focus of our healthcare system from waiting for people to become acutely ill to investing in prevention to keep them healthy in the first place. In 2010, as Dr. Rosas said, we passed an historic health reform law that improves access to the preventive care people need to stay healthy and the screenings they need to detect diseases early. And we've taken some big steps to help seniors afford the cost of their medications. We're also working with doctors and hospitals to share their best methods for improving their patients' health. Now, sometimes seemingly small things like following up with a patient after she's been discharged from a hospital and helping all of her doctors communicate with one another can make the biggest difference. So we're helping the best practices like these spread to every corner of the country so that everyone has access to the best care possible, no matter where they live. But we also recognize that ensuring access to quality, affordable care is just part of the job. Most of our health happens outside a doctor's office, in neighborhoods, in workplaces, in community centers. So just as important are the steps we can take to engage older people as we do this critical work, involving them in the design, execution, and leadership of programs for seniors, and refuting any notion that as people age, they have less to contribute or become helpless. Our growing population of older people is also increasingly diverse. So respecting this diversity is key to maintaining social connections, reducing isolation, and increasing people's choices. Ultimately, what drives our approach is a philosophy that says simply, nothing about them without them. And you can see it in successful initiatives like Stanford University's Chronic Disease Self-Management Program, built on more than 2 decades of federal research. The program recognizes that older people with chronic diseases should be more than just recipients of care. They should be key decision makers in their own treatment. So through workshops in community settings like senior centers, libraries, and faith-based organizations, older people with a wide array of conditions come together to learn, to share, and to build the skills they need to manage and improve their own health, from exercise and nutrition to stress management and communicating with their healthcare providers. Now at HHS, we've invested $27 million in grants to help communities implement these proven approaches. The evidence shows that this program not only improves patients' abilities to manage their own health, it's improved health outcomes and even reduced healthcare costs. So it's no wonder that the Stanford program is now available in at least 15 countries around the globe. What this kind of program tells us is that keeping older people healthy yields enormous dividends. When more people can participate more fully and contribute to society, everyone benefits. And this is where we have an important opportunity to work together, to share our best ideas and tools to keep populations as healthy, productive, and engaged as possible. The United States is committed to learning from our partners across the region and around the globe. The more we work together, the faster we'll be able to test new strategies, learn what works, and implement them in our own communities and in our own countries. Now, one of the most striking aspects of my trips outside our country is how much eagerness there is to work together on health issues. We find often when it comes to trade or foreign policy, there are often areas of strong disagreement. But when the discussion turns to tackling our biggest health challenges, there's a broad consensus that nations must work together. And when we do work together, we all benefit. So healthy aging is an issue which aligns the interests of the countries around the world. A healthier world is one in which every nation will have more productive workers, longer lives, and more vibrant communities. Now, too often, when we talk about global aging, we only focus on the costs. But by keeping all of our seniors healthy and engaged, we've begun to write a new story, where every older person gets the dignity and independence they deserve, and every nation thrives. And we're eager to work together to achieve that very important goal. Thank you very much.